Slated to meet next week at the United Nations to assess the status of the 8 Millennium Development Goals. While Africa is making progress, a lot remains to be done before the goals deadline in 2015. Health experts recently met in Washington to discuss how partnerships are helping to fight infectious diseases in Africa. Infectious diseases are still a challenge for Africa, where shortages of drugs, health workers and diagnostic equipment are common. But some countries, such as Uganda, have found a way around this problem. Nearly 10 years ago, the Washington-based Coutinho Global Health Foundation, in partnership with Pfizer Pharmaceuticals and Makerere University in Kampala, established the Infectious Diseases Institute, or IDI, to address the challenges faced by the estimated 25 million people in Africa afflicted with HIV/AIDS, malaria and other diseases. Foundation Chairman Hank McKinnell.
We did recognize that we could play a very important role in helping train Africans to work in Africa to fight the devastating burden of infectious diseases. The creation of the Infectious Diseases Institute, since its beginning, has trained over 7,000 healthcare professionals. Those students, healthcare workers, have each trained 50 to 80 more.
The IDI's director, Ugandan Dr. Alex Coutinho, says the collaboration has helped save millions of lives in Uganda, enabling health professionals to respond effectively to medical emergencies.
The health system strengthening approach for districts has been an important skill set that IDI is able to offer to the government of Uganda, but also be able to model this, document it, publish it, so that other players in this field understand how best to truly support countries to have sustainable solutions to managing infectious diseases.
Despite the global economic downturn, which has affected many donor programs in Africa, the U.S. government has pledged continued support to fight infectious diseases on the continent.
My plea to all of you is help us to understand the shortcuts. Help define for us out of this meeting and more what we can do to maximize that scarce dollar so we can save more lives, do a better job with less.
As Africa has said, they don't want to be defined by HIV or tuberculosis or malaria, and I understand that. And so we want to congratulate them on their successes, but we also want to make sure that we are continuing the funding with the instructive approach and constructive approach to be able to save lives.
Executive Director Francis Omaswa of the African Center for Global Health and Social Transformation in Uganda applauds Accordia's and other donor initiatives in Uganda, but cautions against dependence on foreign assistance.
With donors being so much interested in the health of African people, which is quite good and justifiable, it has also led to, so to say, taking our governments off the hook. So we need to build a situation where donors recognize that the leadership should be African, and Africans recognize that it is them and not others who are responsible for putting up programs which are credible.
Meanwhile, Dr. Coutinho says while funding can help reduce the number of infectious diseases on the continent, complacency remains a big threat to the gains made so far.
We really need to get the topmost political leadership to again put HIV as sort of the #1 priority in the health field. We have to figure out a way to ensure that even though the visibility of HIV is reduced because of treatment, that populations continue to be aware of the threat and how to mitigate it.
Now, panelists stressed the importance also of strengthening health capacities in rural areas, where they say a lack of equipment, trained healthcare professionals there could hinder targeted goals.